school mental health study is a companion study to the 2014 Ontario Child Health Study. So the 2014 Ontario Child Health Study includes an in-home component and the school mental health study.
In the original study in 1983, schools were not part of the Ontario Child Health Study, and today we realize the critical importance that schools and educators are playing in supporting and promoting student mental health.
This, in some way, is a dramatic leap in terms of design, in terms of ambition to look at and link schools, neighborhoods, and families to better understand children's mental health needs. The advantage of the school study is that we're linking those neighborhoods where we're sampling for the 2014 Ontario Child Health Study to schools that are serving families and children in those particular areas. Those schools we have engaged or in the process of engaging for the school mental health survey. So by bringing these two things together, we can look at the different effects that communities or neighborhoods versus schools might have on children's mental health and different opportunities in these two different environments to improve children's mental health and maybe offset the economic difficulties and social disadvantages that some families experience. This would be the first time, frankly, that that's ever been done at this level anywhere.
There's lots of support for the school mental health study. It involves ministry partners at the Ministry of Education, the Ministry of Health and Long-Term Care, and the Ministry of Child and Youth Services. It's being led by the Offord Centre for Child Studies at McMaster University, but it does have representation or co-investigators more broadly.
So the goals of these school mental health surveys are to look at the available resources for kids in schools if they should need help, and also to look at the school climate.
And so in order to do so, we've randomly selected 13,500 families in 180 different neighborhoods across the province.
And we are going into 240 schools across Ontario, both English and French, Catholic and public schools.
Generally speaking, it involves surveys of students from grades 6 through 12. In elementary schools, it involves the teachers of those students in grades 6 to 8, in addition to just JK to 5 teachers, as well as the principal of the school. In secondary schools, what we're doing is we're surveying students in grades 9 through 12, but we're actually only randomly selecting 3 classes per grade in secondary schools. In addition, the teachers of those classes will complete a survey, as well as the principal of the secondary school. Teachers, students, and principals will be asked around their feelings and behaviors within the school environment and to what extent the school has services or programs or opportunities to support student mental health within the school environment.
So the numbers involved in our school mental health surveys are pretty impressive and ambitious on our part. We are sampling 240 schools across the province. That will involve 240 principals, about 3,500 teachers, and over 26,500 students in those schools. Our team will be providing all of the materials needed to complete these surveys. This involves promotional materials like posters and information brochures for teachers. It also involves all the consent forms that need to go home with kids, and of course the survey materials themselves. Everything will come packaged and labeled so the appropriate class gets the correct surveys. It all comes shipped to your school from us.
After they're filled out, they'll be shoved into a nice envelope and sealed and brought down to the front office, and then we pre-arrange FedEx to come and pick up the surveys from each of the selected schools and bring them back to our office. We will then enter them into our research data system. No one will be able to link what each student, teacher, or principal said to the actual data that's recorded into our system.
And really, there is a lot of flexibility on the parts of schools in terms of when they can complete the survey, what sort of support they might have, things like that.
We've pre-arranged with the principal or asked the principal to pre-identify whether or not they would like on-site support during survey day. If the principal feels like that's something that they would be interested in, our research team arranges either with the mental health leadership team of your school board to have someone on-site from that team during survey day, or someone from our research team can come out there.
So in order to prepare for your role as a facilitator, the most important thing would be to familiarize yourself with the surveys themselves and read them over, make yourself comfortable with the content, as well as the instructions that we're providing for the schools and the classrooms about how to actually administer them. And to do this, we'll be providing you with materials from our team, but as well our website, ontariochildhealthstudy.ca, is an extremely valuable resource full of information that you could look through.
We do have a facilitator document that anyone who's willing to help with this study can read. It does outline the objectives of the research project in addition to what implementation at an elementary and a secondary school would look like.
We say these surveys are designed to be hassle-free, and by that we mean that everything will be clearly labeled in packages, everything should be handed out relatively quickly, and instructions are provided and scripts are provided, so really there shouldn't be a lot of ad-libbing on the teacher's part. It will be all laid out clearly for them as to what needs to be done, how and when.
The school study is just a massive one, and I mean, we've already talked about its importance for Canada, as it'll be the first study ever to characterize the influence of the school environment on student mental health. And the sheer number of schools makes it a difficult undertaking for our small team at the Offer Centre to implement on our own. So I just want to say that your willingness to consider being involved in the study and to help facilitate the process, we're tremendously appreciative of that. We're here to support you as well. We want this to be a rewarding experience for everybody, and I just want to thank you for the work that you're about to do, and remind you that we're all excited about what this will mean for child and youth mental health in Ontario.